This video is part of the training that you will receive to learn how to give parenteral nutrition, PN, through a central venous catheter, CVC. The video will be used in addition to face-to-face sessions that you will have with hospital staff and any written information that you will be given. The environment where you carry out the procedure must have as little air movement as possible. Germs, viruses, and other infective organisms can be carried in the air. If enough of these get onto the equipment and then into the CVC or PN, they can cause very serious infections. Make sure that all windows and doors to the room are closed and fans are switched off. Bed making, nappy changes or stoma care should be done at least 30 minutes before the procedure commences or be left until afterwards. The number of people in the room should be kept to the minimum needed. Put on a plastic apron and wash your hands with liquid soap and water. Turn on the water and wet your hands. Apply the liquid soap. Rub your hands together using the following sequence and 3 to 5 good strokes of each action. Palm to palm with fingers interlocking, palm over the back of the hand with fingers interlocking, and then do the other hand. Rub the backs of the fingers into the palm. Rotational rubbing of fingers into palms on both hands. Rotational rubbing of thumbs clasped by the opposite hand, and then swap hands. Finish by cleaning both wrists. Rinse thoroughly under running water and then turn the tap off. Use the paper towels to pat your hands and wrists until they are completely dry. It is important to make sure that your hands are dried completely so that your skin does not become sore, and dry skin is less likely to attract germs, viruses, and other infective organisms from the air. If the CVC is visibly dirty, or you know that it's been contaminated, for example in bath water, with stool or vomit, use gauze swabs, a clean bowl, warm water and washing up liquid. Wet some of the gauze swabs with a clean water and put a very small amount of washing up liquid onto the gauze and lather. Clean the CVC starting at the hub end and then move down to the clamp. If necessary, the clamp can be released and moved to the clean area underneath. Always start at the hub end and never move back up the catheter to the hub. Wet a second piece or pieces of gauze and rinse the CVC in the same manner as it was cleaned. Use the remaining gauze swabs to dry the catheter thoroughly. Leave the catheter in a position where it can be easily accessed and kept clean. Wash your hands as before to make sure that if they were contaminated whilst cleaning the CVC, they are clean before you commence the procedure. If you are confident that the CVC is clean, you can proceed to prepare your trolley. Using washing up liquid and water, wash both surfaces of the trolley and any other smooth, hard surfaces that you will be using to put unopened equipment on. When you are cleaning the trolley, make sure that you also keep the joint area in the middle clean. Rinse the soap off the surfaces using clean, wet paper towels. Dry the surfaces thoroughly using clean, dry paper towels. Clean the top surface of your trolley with a 70% alcohol wipe using a side-to-side motion and covering the entire surface area. The alcohol must be allowed to air dry for at least 30 seconds, longer if it still looks wet. Alcohol must always be allowed to dry for it to kill germs, viruses and other infective organisms. Get all of the equipment that you will need for the procedure and place it on the bottom of your trolley or the other smooth, hard surface area that you have cleaned. Check that the equipment packaging is not damaged in any way and does not appear to be or have been wet, which could mean that the contents are no longer sterile. Check that the expiry date is not passed. If there is any doubt that the contents of any of the packages may not be sterile, discard them. Check that the vials are not damaged in any way or leaking. And make sure that the contents label is correct and the expiry date is not passed. Clean your hands with alcohol gel using the same 7-stage technique that you used for washing. Keep rubbing your hands together until the gel is completely dry. Put on a pair of non-sterile gloves. Gloves should be left in the box where they will be protected from dust until you are ready to put them on. Clean the neck of the 0.9% sodium chloride ampule at the point where it will break using a CHG wipe for 10 to 15 seconds. Put the vial on top of the trolley without touching the key part that you have cleaned. Repeat this step with the Hepsol 10 units per milliliter vial. You can use the same CHG wipe for both if it is still wet. Leave both of these to air dry for at least 30 seconds and longer if they still look wet. Open the 10 milliliter syringe packaging by peeling apart from the plunger end to approximately halfway. Fold the packaging away from the syringe and place it between your thumb and forefinger, keeping the packaging tucked into your hands to prevent any accidental contamination of other equipment. Open the green needle in the same way, taking care not to touch the needle hub, which is an exposed key part. Join the syringe onto the needle as quickly as possible to keep the exposure time for the key parts to a minimum, taking care not to touch the needle hub. Put the syringe and needle on the trolley and throw the packaging away. Partially open the end cap packaging to allow easy access when it is needed. Cover back over and place it on your trolley. Remove the top of the 0.9% sodium chloride vial, taking care not to touch the area where it breaks. Put the vial back down onto the top of the trolley and throw the top away in the rubbish bag. Remove the green needle cover, leave the vial on the trolley surface and put the needle into the 0.9% sodium chloride vial and draw up at least 5 milliliters. Knock the air bubbles to the top of the syringes and then push the plunger to expel the air. Remove the needle and put it in the sharps bin. Take the end cap out of the packaging by holding the middle part, taking care not to touch the part that will go onto the syringe. Place the end cap firmly onto the syringe. Put the prepared flush down on the trolley. Throw any remaining equipment or packaging that is not needed in the rubbish bag. Open and join the second 10 ml syringe and the filter needle in the same way as before, and then place it down on the trolley. Get the end cap ready for use. Open the gauze package and place the gauze on the top of the trolley. Snap the top off the Hepsol 10 units per milliliter vial using a gauze swab to protect your fingers. Remove the needle cover. Draw up 5 ml of the Hepsol 10 units per milliliter in the same way as for the 0.9% sodium chloride. Expel the air. Replace the needle with the end cap. Throw any remaining equipment or packaging that is not needed in the rubbish bag. Open 2 CHG wipes and place them on the top of the trolley. A third wipe may be opened to use if any key parts become accidentally contaminated. Get the CVC end cap ready for use. Remove your gloves. Position your trolley and waste bag so that you can carry out the rest of the procedure without unnecessary twisting and stretching. Move the CVC into a position where you can access it easily. Alcohol hands. Put on a clean pair of gloves. Using a CHG wipe, clean the CVC and giving set connection by rubbing for 10 to 15 seconds and making sure that there is a good application of the solution to the connection. Hold the CVC, taking care not to touch the connection. Throw the wipe into the rubbish bag and allow the connection to dry for 30 seconds, or longer if it still looks wet. Clamp the CVC. Disconnect the giving set and allow it to drop away from the work area. Clean the exposed CVC hub using a CHG wipe for 10 to 15 seconds. Throw the CHG wipe into the rubbish bag. Allow the CVC hub to dry, taking care not to touch the hub, and if possible, keep it pointing downwards so that dust cannot fall into it. Using a two-hand technique, remove the end cap from the 0.9% sodium chloride syringe, taking care not to touch the key parts. Connect the syringe onto the CVC. Throw the end cap into the rubbish bag. Unclamp the CVC. Using a push-pause technique, inject the 0.9% sodium chloride into the CVC. Apply the clamp as the last half milliliter is being injected to create a positive pressure. Remove the sodium chloride syringe and throw it into the rubbish bag or onto the bottom of the trolley. Remove the end cap from the Hepsol 10 units per milliliter syringe and attach it to the CVC, taking care not to touch the key parts. Throw the end cap into the rubbish bag. Unclamp the CVC. Inject the Hepsol 10 units per milliliter using the push-pause technique and clamp as the last 0.5 milliliter is being injected. Remove the Hepsol 10 units per milliliter syringe and throw it into the rubbish bag or onto the bottom of the trolley. Take the end cap out of its packaging, taking care not to touch the key part, and attach it securely to the CVC. Remove gloves. Alcohol hands. Secure the CVC to the body in a position where it is least likely to be contaminated with stool. Throw the rubbish away. Wash the trolley if it is necessary and store equipment safely.